Hello, this is Dr. Ruby and welcome to the lecture for Module 12, the Functional Anatomy of the Foot and Ankle. This module's objectives include explaining the interdependent relationship of the foot and the ankle as it works synergistically to produce force, reduce force, and stabilize the entire kinetic chain during functional movements. The first muscle that we'll discuss is the anterior tibialis. It originates on the lateral surface of the tibia and inserts on the medial surface of the medial cuneiform and the first metatarsal. The isolated function of the anterior tibialis is dorsiflexion and inversion. An integrated function is that it eccentrically decelerates plantar flexion at heel strike, and it eccentrically decelerates pronation of the forefoot. A weak anterior tibialis can create eccentric overload to the posterior tibialis, the soleus, and the flexor hallucis longus. A weak anterior tibialis may cause increased hip flexor activity during the swing phase of gait, which will increase stress to the lumbopelvic hip complex in individuals with reduced core stability. The posterior tibialis originates on the interosseous membrane, the posterior medial fibula, and the posterior lateral tibia. It inserts on the tuberosity of the navicular, the medial cuneiform, and the metatarsals of 2 through 4. The posterior tibialis isolated functions are that it plantar flexes the foot and inverts the foot. It stabilizes the medial longitudinal arch. Its integrated functions include eccentrically decelerating the subtalar joint pronation by controlling subtalar joint eversion and internal rotation of the tibia. It also eccentrically decelerates mid-tarsal joint pronation assisted by the soleus and the anterior tibialis. The posterior tibialis works synergistically with the soleus, the flexor digitorum longus, and the flexor hallucis longus to decelerate the forward momentum of the lower leg. During mid-stance, the posterior tibialis concentrically accelerates the subtalar joint into supination and externally rotates the tibia. A weak gluteus maximus may be due to a tight psoas, with a weak gluteus medius that could be caused by an SI joint problem, can cause tissue overload to the posterior tibialis and lead to posterior tibialis tendinitis or shin splints. A weak posterior tibialis increases the frontal and transverse plane stress to the knee and can cause patellar tendinitis. A weak posterior tibialis can also increase the transverse plane stress in the lumbopelvic hip complex, leading to SI joint problems. The soleus originates on the posterior surface of the head and upper shaft of the fibula and soleal line of the tibia. It inserts on the calcaneus via the Achilles tendon. The isolated function of the soleus is plantar flexion. Its integrated functions include eccentrically assisting in the deceleration of subtalar joint pronation and internal rotation of the lower leg at the end of the contact phase of gait. It also decelerates ankle dorsiflexion, which assists in knee extension and propulsion in gait. It accelerates subtalar joint supination with propulsion. A weak soleus leads to tissue overload of the other synergists, the posterior tibialis, the flexor hallucis longus, and the flexor digitorum longus. This possibly leads to patellar tendinitis and/or posterior tibialis tendinitis. A short soleus decreases sagittal plane dorsiflexion, which increases the frontal plane and transverse plane compensations of the entire kinetic chain. This is an important concept. In gait, we call the dorsiflexion that happens when you come over stance phase of a leg the ankle rocker. Without adequate ankle rocker or adequate dorsal flexion, there will be compensations throughout the entire kinetic chain. There may be more movement at the forefoot, there may be hyperextension in the knee or in the hip, which can cause pain and problems up through the lumbar spine. The gastrocnemius originates in the medial and lateral femoral condyle and inserts on the calcaneus via the Achilles tendon. The isolated function of the gastrocnemius is plantar flexion. The integrated function is that it eccentrically assists in deceleration of femoral internal rotation. It eccentrically assists in decelerations of subtalar joint pronation, or eversion and internal rotation, and it concentrically accelerates subtalar joint supination, assisting in plantar flexion and external rotation. The gastrocnemius can become short and overworked from weak proximal external rotators. These would be the piriformis, the biceps femoris, and the gluteus maximus. A short gastrocnemius decreases sagittal plane dorsiflexion and leads to increased total kinetic chain pronation. Again, this could irritate or inhibit the ankle rocker needed for gait. The peroneus longus originates in the upper two-thirds of the lateral surface of the fibula. It inserts in the medial cuneiform and base of the first metatarsal. The isolated function of the peroneus longus is that it plantar flexes and everts the foot. Its integrated functions are that it stabilizes the first ray in the transverse plane, allowing for proper foot function. A weak peroneus longus allows increased supination, leading to a rigid foot and increased compressive forces in the lumbar spine and sacroiliac joint. This concludes the lecture for Module 12. Please move on to the discussion.